Hey there, it's Dr. Jewa Lea with day 11 of the Whole Heart Living series. Wanted to speak on chronic inflammation, the persistent irritant, and how it can lead to heart disease. Well, a while back we talked about heart coherence, which is how the heart beats and how it interacts with the other systems of the body. When the heart is in sync, or when the other systems of the body are in sync with the rhythm of the heart, that's called coherence. And the body and the heart operate efficiently and function well. However, when that doesn't take place, then we have disease processes that occur. And one of the things that can lead to this incoherence is the heart's not operating is sending out signals based upon a negative thought pattern. And we spoke on that, how the HRV can be a ragged signal with a negative thought, or like frustration or anger, as opposed to a nice smooth signal with appreciation or cooperation or loving thoughts. So what happens when we have incoherence with the heart? Well, inflammation can result. So how's that possible? Well, if you think about inflammation is the result of a persistent irritant. It's a natural response in the body to help cool down something that is overheated or has been injured. And so a lot of times with Western medicine, they look to quell inflammation without really addressing the root cause of it, what's causing the inflammation in the first place. So with chronic inflammation in regard to the heart and the coronary arteries in particular, when they become inflamed, what happens is that the natural response of the body to help quell that inflammation is to put calcium or a plaque buildup within the arteries to help cool down the inflammation that is there. Like I said, the body's always responding to its environment 24/7. So in order to reverse plaque buildup, you would want to address the inflammation, because that's why it's there in the first place. So what would be the persistent irritant that causes the inflammation? Well, one of the things that is overlooked but has been shown in recent studies to cause irritation of the arteries is negative thought, believe it or not. With negative thought, you have a cascade of things that happen, and one of those things is a chemical reaction. So each is a physiological and energetic response in the body, and with negative thought, heart coherence is not possible. Negative thoughts and emotions result in the release of a cascade of chemicals in the body, such as epinephrine, cortisol, substance P, to name a few, and that it has been documented that ruminating on a negative thought can increase levels of C-reactive protein, which is a marker of inflammation. So, in fact, C-reactive protein levels were shown to be increased hours after a negative event had ended, giving evidence not only to the negative event, but to our ruminating thoughts, ruminating meaning churning thoughts, long after the event is over. That leads to an inflammatory response that directly affects the heart. And so this research shows that all the if I coulda, woulda, shouldas after event are actually detrimental as the event itself. So in order to negate inflammation, you would want to address this ruminating behavior. And so there are several techniques out there that can help with that. One of them is one of the techniques that I offer in my practice. It's called bioenergetic synchronization technique. It looks at negative thought patterns and helps break those patterns so that they no longer have an influence on your body, and then your body can heal itself. And then there's also the emotional freedom technique, which is called EFT. There are plenty of videos on YouTube about EFT if you want to look that up. The Sedona method is also another one that helps break memory patterns or ruminating thought patterns. And then freeze frame and the M-Wave biofeedback that's done by the HeartMath Institute in Northern California. So I utilize a couple of the techniques in my practice. BEST is my primary go-to, and the Sedona method, and then using the biofeedback tools offered by HeartMath. Those are the things that I offer in my practice for those who have trouble letting go of negative thought patterns. Post-traumatic stress disorder would be would fall into that category. I've treated veterans and soldiers who have had that successfully. People who have had depression, chronic depression, had gone through talk therapy for years. After a few sessions with BEST, they were able to help negate those thought patterns and showed fast improvement. So the impact of negative thought cannot be downplayed, not just for the thought itself and the mood that it puts you in, but also the physiological responses that happen in the body, including chronic inflammation, and most specifically in relation to the heart, chronic inflammation of the coronary arteries that lead to plaque buildup. So again, addressing root cause would be the most efficient way of dealing with the persistent irritant that leads to chronic inflammation. Hope this helps. If you have any questions, drop me a line in the comment section. I respond to all the comments. And if you have issues with ruminating thoughts, negative thought patterns, or just having problems breaking a negative thought cycle, drop me a line. I'll be happy to help. Again, my name is Dr. Jewa Lea, and this is day 11 of the Whole Heart Living series. I look forward to seeing you tomorrow. Take care.